Hi, I'm Dr. James Webb, and I want to talk about some of the other services we provide at the Osteoporosis Institute, including pain management. We take a different direction with pain management than a lot of other physicians in clinic practices. Our goal here is to help patients achieve freedom from pain without resorting to invasive surgery or narcotics. What really gets me motivated to come to work every day is being able to help patients. I mean, that's why I became a doctor. And in this practice, when we help patients with pain overcome their pain struggles, that's really rewarding. And there's not much that's better than that for me as a physician. For example, I had a lady who had had pain for 5 years, and the diagnosis eluded all of her physicians she'd seen. She even had surgery to remove her spleen, thinking this would get rid of her pain that she was having. But by a careful history and physical examination, we were able to isolate the cause of her pain, treat it, and her pain was gone afterwards. And to think that this lady had been suffering for 5-10 years with this pain is just unimaginable. So it's really my privilege to be able to help patients like that. We see a lot of patients that come in on just tons of prescription medications that they're having to take, so much so that it's like taking a meal to take all their medications that they take all day. And by tailoring a plan to help them improve in other ways, then a lot of times we're able to get them down where they're taking a fraction of the number of pills. Or we have a lot of patients that end up being off of pain pills. And another patient was an older gentleman, came to us. He was in so much pain and suffering. His marriage was suffering. He couldn't work. He didn't enjoy the usual things he liked to do, like gardening. He basically told us, hey, Doc, I'm ready to give it all up. I mean, he was thinking about ending his life. Well, we took the time to listen to him and find out what was going on. And, not only were we able to help his pain, we were able to give him his life back. Probably 90% of the people that we see that go through the traditional approach for pain management do pretty well. It's the 10% that don't that have the problem. And a lot of times the doctors are, they're not familiar with it. It kind of defies what they usually do. Luckily for those patients, that's kind of what we specialize in. We see those patients are pretty much our 90% of patients, and we're able to do really well for them. One of our most popular alternatives to invasive surgery is called a medial branch ablation, which is a $20 word for we take the nerve that senses a lot of the back pain and sends it to your brain and basically cut the telephone line. That usually works about a year at a time for people. Patients love it. So many of our patients who are now pain-free were once told that there was nothing that could be done for them, that they were a hopeless case, that they couldn't have surgery or they were going to have to live this life of chronic pain pills. And we didn't take that for an answer. The patients didn't take that for an answer, and they came and got a second opinion from us, and we were able to help them. So if this kind of story resonates with you, or if you've been told that there's nothing that can be done, or your doctors have thrown their hands up and said, here, take these pills, that's all we can do for you, come get a second opinion from us. I'm pretty sure we can help.